Hi and welcome to my next short video, and today I'm going to be talking about movement through the horse and specifically how the femurs move through the horse and how it affects the stride of the horse and actually the angle of where the pelvis is going and stuff like that. So you'll have seen the pictures of the pelvis, and I thought I would just help you as an owner understand a little bit more about the points that you can see on the pelvis. So here we have the equine pelvis. Obviously not a real one, or else it would be the tiniest horse in the world. And as you can see, even when I'm making them, they're pretty symmetrical. I'm just doing one that's asymmetric and has all the things which we see in real life. But often what we will see is a slight asymmetry through here. But what we don't want to see is a big asymmetry and maybe a movement like this. So what we will have then is we will have what we call a rotation and then a forward shear as the horse's pelvis moves there. And normally that tells us the horse has maybe had a fall, or it's happened and the soft tissue has then started to compensate. And like I say, we come into these horses years after, so what we don't want to be doing is jiggling about, making sure everything's straight without addressing the soft tissue as well. But the points you can look at as an owner, you can, if you run your hand where the back of the saddle is, keep going, and then you'll start to come up onto the bum of the horse. You will feel two bony protrusions, and these are called the tuber sacral. And here we'll have the sacrum, and then deep down here we have the sacroiliac joint. So you'll often see therapists moving on one and moving on the other to make sure it has good motion through the pelvis. And then the other one, if you stand at the head of the horse and look towards the rear of the horse, you will see these two bony points sticking out here. And these are called the tuber coxae, or the point of hip. And then if you run your hand, keep going from the top here, start running down here. And then what you will feel as you come over the hind end of the horse is your hands will sort of come up and then slope down, and you'll feel a bony protrusion, and these are the tuber ischium. So these are at the bottom, and it's often what therapists will run our hands over the back of the horse. We'll feel that these are nice and level. We'll check these are nice and level, and then we'll run our hands back down and we will check these are nice and level. But we're going to be talking about the leg bone that comes from the pelvis and how that movement can affect how the horse rotates and moves throughout the body. So we have this bone which comes off the pelvis here, and this is called the femur. So it's one of the longest bones in the horse's body, and it inserts here, and it's a ball and socket joint, and we call this the hip joint. And it can get quite confusing because you'll have your therapist call this the point of hip, but actually this is the hip joint here. And often what you'll feel if you run your hand down the side is you will feel this bony protrusion here. And then it comes off here, and then at the front of here, you can see we have the patella here. So this is the knee joint, which will fit in with the tibia, and we call that the stifle joint. But this is the little bone across the front, what we will feel as a therapist when we run our hands across the front of the horse. So obviously they have one on each side, and they're connected by deep muscles. There's lots of muscles which fire off of here, and lots of ligaments and tendons. But mainly what this action will give is flexion and extension, adduction and abduction. So in simple terms, forward, back, in and out. And you can do this with your own leg. You will often find, especially if you're my age, you can move your leg quite happily forward and back. You can even move it to the inside, but when we ask for that coming out, it can often be quite painful. And we often associate that pain with all the muscles that are coming up. So all your hip flexors that are coming up, so it can actually pull further on in your back, and horses can get exactly the same pain. So the action of the right femur, when this moves, it will swing out and come round like this. So this is like the swinging leg. And the action of the left femur, this is more of a straightforward. So this action will have a more straightforward action. And this is my only theory that, you know, that I have found that often when your horse has had a lot of problems, say it's had kissing spine and stuff like this, because the horse has been moving differently, all this right hind, we all have right hip problems, most horses have right hind problems, all this force of this swinging, I think, rotates through the body. And then often we see after our horse is recovered from all injuries, the left fore is always the problem leg. And I often think, I wonder if it's the swinging action that is propelling all that force down onto the left fore. But that's my own theory. So when I'm looking at angles in the horse, the most important angles for me for posture is the pelvic angle and the scapular angle, because this is what you'll see do the lines as well. So we have the scapula here, because the angle of the pelvis and the angle of the femurs will determine the angle of the scapula. So often you'll see the horse has lower on one side in the pelvic area, but then often you will see one shoulder bigger than the other. So it's really important when we look at them, we will look at angles. And if you're buying a horse, especially if you're a dressage rider, the most important angles you look at are the scapula and the pelvic angles, because that will tell you how well your horse is going to perform. So when we think of the hind end, we have to think of propulsion. So this is what, if everything's good in the hind end, then you're going to get really good propulsion for your big athletic moves and stuff like that. Things that can go wrong, if your horse fractures a pelvis, it can often affect this. These are quite rare to be fractured, I would suppose. I'm not a vet, so I don't know, because they're quite a big, heavy bone. But yeah, I just thought I wanted to show you the angle of this sitting in here relating to movement. And then we can see, if you just remember, the right swings, the left steps straight. And then when we look at the horse move, when we're walking away, and you will see that swing through and you will see that straight if you go and video your horse walking away. And what this does, often we think the pelvis moves up and down like this, but it doesn't. It has a little slight movement like this as it moves. And that's what we're watching when we watch the horse walking away. We're looking for that big swing through that goes like this. So I hope this helps. It's going to go with the post about the femur, and I can delve in deep, but I want owners just to understand the basics. You know, like, do you really need to know which every point is on the femur? Do you really need to know every single muscle, every nerve, what comes off it? Or do you just need to understand the function and form? And when you look at your horse, you can go, oh my God, yeah, my horse's right leg does swing out. And then you can school, so you can actually see the action of the horse going around like that. So yeah, and it's just a bit clearer rather than in pictures, so you can actually see the pelvis. Or me doing this with my, how to describe a pelvis, long index finger, knuckled third finger, and thumb down. That's how I describe it. And then if I'm describing it to an owner and it does have a rotation, you can obviously, I can do this and I can do this so the owner can see. Now you can understand, if someone tells you your horse's hip is out, how very hard it can be. It's very rare anything is out. It's usually a soft tissue which is creating a pull. But yeah, hopefully we will get the pelvis made a little bit more asymmetrical. We don't want normal here. We want the horse's normal. And yeah, I hope this helps. Bye.